Ryan, we all try to prepare healthy meals in the kitchen, but sometimes with rushed schedules, it's not always so easy. Joining us today is Dr. Aziz Benbrahim, the medical director, weight management expert, and a general surgeon at Midstate Medical Center. Doctor, thank you so much for being here.
My pleasure.
How true is the saying, you are what you eat?
It's actually very true. When many years ago, and our parents really ate what they have produced in their land, and it was very healthy for them. Now, whatever we eat really can impact our life.
Sure. So what would you say, doctor, are the components of a healthy diet? What are we looking for?
Going to the basics. If you go to like a French, I had said in nutrition, he said you just eat whatever flies, whatever swims, as well as fruits and vegetables.
Sure.
Anything processed, anything handled might not have the right things for you.
So stuff from the earth, I guess, right?
Absolutely.
That's what we should go with.
Absolutely.
So today we're having a Moroccan dish. In fact, you made some already for
Yes,
us, which looks beautiful.
Full disclosure, my wife made it.
All right, fair enough. We'll give her credit.
So basically, I can show you the final product, which is this one, and it has basically chicken, preserved lemon, the Moroccan way, as well as green olives and many ingredients. I can tell you right now what they are. So basically, it's very simple. Everybody can make this dish. It's not complex. Absolutely.
Your wife made it today, Doc.
Well, I taught her how, and she put the French thing in it.
All right,
but
fair enough.
Basically, what it is, it's very simple. And
we'll switch spots.
Thank you. The best thing to do to think about a healthy diet is switch from sauces to spices.
Okay.
The sauces have so many calories. Spices are just 3 or 4 here I have ginger, I have turmeric, I have salt, and I have pepper.
Okay.
Everybody has access to this.
That's true.
Otherwise, you can, anytime you use shallots and you use onions and you use garlic, as well as cilantro and parsley, it gives a great taste to anything you prepare.
And doctor, talk to me about the lemons.
So this is preserved lemons. These are in Morocco, basically what we do, we take lemons and we preserve them in salt and their juice, and you leave them for a few weeks. And after that, when you finish doing that, basically what you do to prepare them, and you can eat them and cook with them, basically you open them, and obviously we have to keep only the skin because the inside has a lot of salt and you don't want that. And then as you will see in the tagine, so you just remove this, and in the tagine you can see them already there.
Yes. And what is this called again?
This is tagine.
Okay.
Tagine, which is T-A-G-I-N-E. It's the dish, and it's what you cook also in it.
Very good. So should we start cooking?
Yeah, it's very good. So how about if you try to do it yourself? I can just
All right,
help
you'll have to show me what we
very
need
simple.
to do.
So,
we could do that.
So let me just put this here. So just put all the first ingredients, which will be this.
Shallots go right in.
Okay,
a little bit of garlic.
And then parsley and shallots.
Okay.
All right, so I'll give you, this is with, I have already the olive oil and all the other, the spices we talked about. As a matter of fact, it's a very good way to do it. You mix all your spices first and put them in a bottle of olive oil.
Oh, sure.
So when you come home, you don't need to be mixing them. You just take the mixture. It has to be thick, okay? Take the mixture, and then you put it in, all right? And this will give you the taste you want. So what we will do, we will start,
Just put this here. So we're cooking with some steam here.
Just be careful, turmeric is yellow and you don't stain your lovely clothes. So how about if I start with this one here? I'll do this one and then start.
That would work.
All right, good. All right, so after what we'll do also, and I have not done it before the show, but you take also your chicken. Here we have some chicken, and I like the thighs. I like them better than, but you can choose any type of part you want. Then what you do, you mix your mixture also with it, and you do it for about half hour or so.
Okay.
You just want all the ingredients perfect.
All right.
So we'll do that.
And doctor, what type of options are there at Midstate for weight management?
So we have actually any weight management or treatment for obesity, there are 4 things. Like 4 legs to a table. You remove a leg, the table falls.
Right.
You have healthy diet, healthy exercise, changes in behaviors, as well as surgery if you are a candidate, bariatric surgery. So as far as the diet, we have dietitians, either inpatient or outpatient. We have our psychologists to help. And also we have, especially if you are obese, you don't know which exercise you can do, what's healthy for you. We have our rehab network, which will tailor your exercise to your handicaps.
Very good.
And then the last one is about 10% of the obese patient needed surgery, and we do it with the robot, with laparoscopy, with the most advanced way for the last 10 years.
Sure.
And so these are basically the. So now it starts already to smell good.
Yes, it certainly is.
So now all what we need to do is we'll put now our chicken. I'll help you with this one.
Okay, good. Do you want my help in the operating room also?
That will be a little bit more complicated.
It probably will be.
So that's great. So that's that.
Great.
And then what we'll do now, we'll just make sure that this is a little bit brownish. And the reason you want to do that, you want to seal the fluid in your chicken and the flavor so it stays moist when you cook it. As a matter of fact, if you were in Morocco, this meal will be slow cooking in a dish like that one.
I see. In fact, we have about 30 seconds left.
Okay. All right, so we
this
just add some water.
Add a little bit of water.
And then you leave it until it's half cooked. And then you will add the preserved lemons, like I prepared them already.
And the olives.
And the olives.
This is a nice traditional healthy dish.
So that's it. So I'll put it here. There we go.
Very
and
nice.
then you cook it about 45 minutes and you're all done.
And that was easy. I mean, you prepare a little bit ahead of time and you get it done.
Absolutely.
We're going to dig in at the end of the show. Doctor, thank you so much for being
My
here.
pleasure. Thank
and
you
of course,
very much.
you can call 1-800-DOCTORS or check out Midstate Medical's website at midstatemedical.org.